Och god morgon och förlåt, min svenska är inte så bra att jag tänkte att det är bättre för alla att jag har min presentation på engelska. Så, men frågorna gärna på svenska. I noticed when listening to the presentation for Norway that we have a lot of in common. Very much the same situation and I suppose very much the same history and background. My presentation is a little bit different. I'll cover also broader perspective of the background, how we got to the situation on legislation on public health and especially intersectoral activities there. Just show some background. As I said, we are very similar to Norway, and we have the same opportunity also. The municipalities in Finland are really autonomous and covering all the basic services for the inhabitants, and therefore it's a good place to have intersectoral cooperation and intersectoral activities. But it's also a challenge because the municipalities are so autonomous how they in practice implement these activities. And in the end of my presentation, I will shortly describe the situation, what is going to happen in Finland in the near future. We are going to have totally new structure of social and healthcare services in 2 years. In short, legislation is not the first one we think we need in place. First, we need development and contents for law, and also tools for implementation. And therefore, our history in Finland has been very much we have started in very traditional health problems and then continued to large-scale programs. But what we think and where we are now more is that we are now having the legislation and also systematic work, permanent structures, which all are necessary to be there. And as you can see from the title, in Finland we are not anymore speaking about health promotion as separate item. We are very much having the well-being perspective, because in the municipalities for a long time and also in the ministry these are together. So the two sectors are there together. So coming to the legislation, we have in our constitution a statement concerning the well-being of inhabitants. We have Local Government Act from '95 also stating for municipalities the responsibility to take care of the inhabitants. And we have public health legislation from '72, not in the beginning so much covering the intersectoral activities, but later on it included that too. And now the newest one is Healthcare Act, which covers all the healthcare services and also public health, which I'll describe more in detail. But first, shortly about the history, why we have ended up in this kind of legislation and this kind of situation. About the history, it was very interesting to hear about Ilona Kickbush speak about Ottawa and all this. There are a lot of interconnections between the history and development in Finland. We started in early 70s with very strong priority on primary healthcare and prevention, and already at that time the social determinants of health and role of other sectors were strongly included there. We started with nutrition, smoking, accident prevention, etc., which all in a way demanded for intersectoral activities. And in 1980s, we had a Health for All program, including the intersectoral perspective very strongly included, and continued on that basis in 90s. And in 90s, membership of the EU very strongly also made it important to have intersectoral activities while we prepared our own positions for EU. At that time, we also launched an advisory board for public health, which have members in all the ministries, and it's still working on very good basis and very good forum for activities which are common for all sectors. And we renewed our Health for All program in end of the 90s. And then health in all policies. It's like a red ribbon in all these developments. And 2006 we promoted it also to the EU. And at the same time we have also it included in the legislation of municipalities in Finland. So also on national level and EU and international level the same issue. And recently we have these broad objectives and programs. And what I especially would like to emphasize here is that our current government has stated that health and well-being will be taken into account in all decision making and all sectors, etc. So it's something which is very general and can be taken as just a statement. But we really, the civil servants, now try to put this into practice, to create. We have a law, we have legislation, but we need more tools, more structures, more processes, so that we in future can say that our government stated this, and we are in a way in the future also basing our activities on this. So really a big opportunity for us. So going to the legislation, this list is very much the experiences which we had from the past and which we try to include in the law. The duties of municipalities on health, promotion of health and well-being. So what is important is the commitment, which has been emphasized several times during these days here, and especially Ilona Kickbush, but others as well, for Norway's perspective as well. So long-term commitment, and commitment, it's so important, it's essential to be there, because without that we don't have any success. But we need also capacity on public health, because the other sectors are not doing anything if we ourselves are not promoting this and providing information and in a way advocating for this activity. So that's really something which I think it's not perhaps always enough respected. Institutes of public health, for example, are really important. They are necessary in this work. And what already this morning was discussed, the data. We need the data on national level, but also on local level. Data about the development, about the situation, about the impacts of activities. So, and also analysis. It's not just that we are providing the data and you have yourself in a municipality take care. What does it mean in practice? So this is really valuable and a really important part. And once again, the national institutes are in a high position there. And what was interesting, yesterday, Ilona mentioned health literacy. For us, it has been written down as one of the targets for a long time. And it's really nice to hear her also, once again, emphasizing the role of that. So the health literacy, of course, it's not just the literacy of individuals. We need also literacy of politicians and general public, and so that there's understanding why these issues are important and what impacts all these have on the health of the people. But the literacy doesn't come by itself. We also have to work there, provide information, and in a way create situations where this understanding is growing and getting visibility. And then what also is included in the legislation very strongly is that we can't rely on separate projects and activities which are time limited. We need something which is permanent. Intersectoral structures, processes and tools, all these are necessary there. And it's not only legislation, we need really there something to put this in practice. And therefore, there are different ways of how to implement this. There could be, for example, different kind of committees or working groups, hearings, impact assessment, etc. So but there are a lot of tools which are available, and all these issues which are listed, we try to to include there in the law concerning the duties of the municipalities as well. But these are relevant to the national level as well. So going to the newest law, the Healthcare Law, Healthcare Act, which was drafted or adopted 2010 and came into force 11. So these four elements are the key components concerning the promotion of health and well-being. So there are duties for the local level, for municipalities, that they should have objectives concerning the health and well-being of inhabitants in their strategies. So not any separate new strategies, but include this in a common planning and implementation system of the whole municipality, so that it's not just put aside, but it's part of everyday activities. And also the measures which are needed to implement these objectives have to be written down or defined. Other area of new duties of the municipalities are responsibilities and cooperation, so that responsibilities have to be defined. If it's not defined, usually it happens that no one takes the responsibility. It's not stated in the law how this should be done, but it's said that it should be done. So it's up to the municipalities to decide how they organize issues, but they have to decide who and what organs are responsible for this. And already 2006 we had in a law on public health the duty of municipalities to have cooperation between the administrative sectors inside the municipality, but also with other local actors, private enterprise and NGOs. And that still exists in the new law. And the third one is impact assessment. So that the impacts of decisions on health and well-being of inhabitants should be considered before the decisions are made. That's something which really challenges and, of course, needs also support in implementation. And then the fourth part is monitoring and reporting. And I'll go through these elements just shortly to show where we are and what the situation just now. What I want to emphasize is that all these four elements were first developed together with the municipalities for many years before it was put in the law. So that we had experience and feedback and proposals from municipalities, what they found important and how to implement this. So that in a way it was not as civil servants to writing these down only, but we done it together. So data on how the situation is just now. The data is from this open access online service, which you can hear more about in parallel sessions today if you are interested. But it's really valuable for us. Of course, it's mostly for municipalities, but for us in the ministry, it's also very interesting and important tool. We know about the situation. So now we have these areas which are written down here, but more is done if we have enough resources. So, but it's open information for everyone interested. So not any access codes or anything. And here are the areas which are covered in this. So, but then going to the Healthcare Act and its implementation. So as I said, the objectives and measures have to be written down, and this means very much the commitment of a highest level of the politicians and also the management of the municipality. So this is not a duty of health and social sector, this is the duty of the whole municipality. And but some details about the situation in the municipalities. It was said that objectives have to be set down concerning the needs and circumstances in the area, in the municipality. And here you can see what have been now the most important priorities in the municipalities. Implementation plans have been accepted on these areas, and as you can see, it's the Alcohol and intoxicants, which are in Finland a big problem, which has been emphasized during these 2 days. So it's already known in the municipalities. They are working on that, for example, really hoping to have a good process there. So not going through any more in detail. These are the most common, which has been the priority in implementation of municipal strategies. And then about the age groups, children and adolescents are very much a priority just now in Finland, and elderly as well. Migrants are also becoming more and more important. Then the other area, which is about responsibilities and cooperation, there are a lot of differences between municipalities, which persons or which organs are responsible. Most often it's the management group of a municipality which is having the responsibility of promotion of health and well-being. And the duty which is already from 2006 to have cooperation, it's very well actually implemented inside the municipality, but not so well while thinking about NGOs and other local actors. The cooperation, it's improving, but however there's some improvements to be done. There are also some regional working groups in most of the areas. And also, as was mentioned from Norway, there are these health promotion coordinators in many municipalities, but not so commonly as in Norway. But it's understood that it's needed to have necessary to have someone to have expertise on this area. So about the impact assessment, which is included also in the law. Human impact assessment is a tool which is National Institute in Finland has been developing. It's a challenge still. We have a lot to do on this. Rapid impact assessment is mostly used, very short and simple to use. But however, we still need a lot of support from municipalities on this area. But there is now more awareness about the need to think about the different options and different ways to work, so that it's more transparent, I think, nowadays than it used to be, and all the different options are considered before the decisions are made. So here just an example on what areas there have been impact assessments implemented in municipal board decisions. There are different age groups concerning some health conditions and for example, business. It's now a new way in Finland, very much emphasized that these kind of impacts should be also assessed. Environmental impact assessment, it's a very long tradition and duty on local level. So, but if you can see that socioeconomic status is still a very minor priority here. And that's also a challenge, how to take this forward. The area of monitoring and reporting on health and well-being. So the law sets a duty to municipalities to monitor health and well-being of inhabitants. So that's really good basis in Finland because we have data on that, and also on local level it's available. And also monitoring should be about measures implemented. So what kind of activities have been there and how successful they have been. And every year a report should be given to municipal council about this situation. And every 4 years a more extensive report on health and welfare to the council. In majority of municipalities already last year there was a report on welfare, or there was in preparation such. So that now the situation is that in most municipalities there is such. And also an electronic system is developed for how to use this. About the reporting system, the feedback from municipalities have been that it's perhaps the drafting and working towards this report is the most valuable part of that. To work together with all sectors and to get this information together. So that's something, the process, very, very valuable. And here just about the contents of monitoring, not going more into details. Just shortly, this is my last slide. I described the situation just now in Finland. We are going to have a totally new social healthcare system after 2 years in 2017. All this I described here about promotion of health and well-being will be included in the new law. And as also Timo Stoll mentioned there in the morning session, this is an opportunity for us. While we are now having a new system, new organizations, it's a possibility also to have even stronger role for these activities in the local level. Just shortly, we are going to have 5 regions which are responsible for arranging all the services. And all the social healthcare services will be in the same administration and budget, and also all services ranging from the basic services to very specialized will be in the same organization. How the services are provided, there will be joint municipal authorities, which will provide the services. But these authorities have to provide all the services, all the range of that. So that means that in the future we are perhaps having 25 or 30 that kind of regions or authorities providing the services. Now we have 300 municipalities providing these services. And we are going to have a stronger steering by the ministry and government. And the act is just now for comments in the municipalities, and it will be given in November to the Parliament, and it will be come into force in early 2015. And these activities start already in 2017. So it means that really much work have to be done. And I'm quite confident that health and well-being will be very, very strongly included there for the duties of all these new regions, and also staying as a duty of a municipal level as well. But it's a challenge how to get these work well together. Yeah, thank you.
Da begynner vi å få litt dårlig tid, men ett spørsmål har vi tid til, og det må være veldig, veldig kort. Vær så god.
Og mycket långsamt.
I can do it in English. My name is Ragnhild Spikstedt. I work for the Norwegian Ministry of Health and Care Services. I would like to thank you for the presentation, and I see many similarities between the Norwegian Public Health Act and the Finnish one. And that is not by chance, because both of our ministries were very influenced by the good work that is done in the municipalities. But the thing that is most least similar is the way that you integrate the services, prevention services like maternity clinics into the Public Health Act. And our experience is that once you have a patient that you can point at, they get all the attention. Do you have what reflections do you have on that?
Please, could you repeat the question about the patients? I didn't.
Because once you have a patient, and not the population perspective, does the population perspective lose interest compared to the patients?
Oh, a complicated question. My answer would be no, because it's different. If you are thinking about the whole population, it's now more the duty of a municipality as a whole to think about the population, about the different population groups or different areas or so. But individual patients, of course, their perspective will be taken into account. I don't see that kind of danger at all. So, yeah. But of course, in the future, when we have a new structure, new organization, it will be a challenge how to get the municipal sectors work together with the social healthcare services, which are now in a total different organization. So that's really a big challenge for us in the future. So that the care which is provided for individual patients, of course, there have to be the health promotion as such, but how to get the health and social experts to work with other sectors in the future as well, that's the challenge.
Tusen takk. Også en varm hilsen fra Røros til deg.